Doctors, what's it like when you get sick? Do you go to the doctor or diagnose yourself? I'm a dentist. I regularly tell my patients with TMJ issues how to alleviate their pain, reduce stress, cut out caffeine, sleep in literally any position other than your stomach, stop chewing gum, hold your head neck in a proper position, actually get a night good and wear it. I've had TMJ pain on and off for 6 years. I do all of the things I tell my patients not to do. I do them every single day and often to excess. Long story short, I diagnose myself. I don't treat myself. Me to a patient, you should exercise more, lose weight, not drink, not eat greasy fatty foods, and should see the doctor regularly. Also me, I'm definitely going to MCDs after work and washing it down with a 6-pack. I asked my gynecologist, who is one of several women gynecologists in her practice, where a gynecologist goes for her yearly exam. She said she goes to one of her colleagues, but most of them go to a completely different practice for their exams and stuff. My friend's parents are GPs, and there are laws in the UK so you can't be formally diagnosed etc by family members. So as a kid their parent would take them to the DRS like they have this and this and the other doctor would just nod and prescribe medicine haha. My friend who's a doctor for a hospital always diagnoses herself and will call out due to the fact she doesn't want to get others sick. Her colleagues are almost always the same and completely understand the reasoning. I'm not going to be into doctor stuff today. I'm sick. Well, okay, but you need a doctor's note. I am a urologist. Got testicular cancer during my chief residency year. I was shaving one day and just felt the lump down there. I immediately knew what it was, and that it needed to come out immediately. Scary how fast it showed. One day it's a normal testicle and the other oh there's a hard lump inside. The next day walked into the ultrasound unit to get it confirmed. Spoke to my boss who did the surgery the following day. Ironically I had removed another patient's testicle for cancer just a week prior to that. I come from a family of doctors. I am a doctor, and I grew up knowing basically every doctor in my area. The best story I got is about a doctor we will call Grabo, perhaps one of the most senior and respected internal medicine doctors in my area. My dad is a workaholic. He loves medicine more than anything, and if he could do anything, it would likely be spending more time in the hospital. Me? Not so much. Dad and Dr. Grabo were very similar in how much they love their work. Dad and Grabo over the years became good friends and had a sort of direct and cynical humor they shared with each other. At one point, my dad cracked a joke at Grabo because he again showed up to work even though he was a bit sick. Dad asked, "Hey Gray, when do you think you are going to retire? You are getting pretty old and we don't want to have to pick you up off the floor here at some point." Grabo replied, "I'll never retire. Wait, yeah, I will. When I die." Grabo never retired. A few years later, he was driving back home from an outing with his middle-aged son and he started having a heart attack. While I assume he was experiencing the severe and horrible pain of a heart attack, he just looked over at his son and said, "I am sorry, I am having a heart attack." He passed away after pulling over. The man apologized to his son for having a heart attack that he was completely aware of. I can't say I would have handled that like he did. R.I.P. Dr. Gray. That dude was a badass. I cry to my wife, who is also a doc, and I proceed to refuse every remedy she offers me. My pediatrician once told me an amusing story about when her daughter got sick. She brought her daughter into urgent care among her co-workers and was freaking out, not sure what could be wrong with her daughter. Her co-workers looked at her and went, "You're a pediatrician." "I know, but I can't think straight. My mom's a nurse and has seen some horrible things. She almost passed out when I shattered my arm. It's definitely different when it's your kid." I'm a veterinarian. When my own pets get sick, I turn into a useless, crying idiot. Luckily I have good colleagues to turn to. I'm vet tech. I was helping one of our doctors x-ray her rescue dog's chest due to a cough. I looked at the picture and pointed out she has a bullet in her side. She almost lost it right there. This may vary according to your country, but if I get sick I can diagnose myself in the sense that I can say yep, this is probably X. I should do this and that test or take this or that drugs, but I cannot self-prescribe anything. I need another doctor to prescribe it for me. No pharmacy can accept a prescription with the same name for the doctor and the patient, and no clinic can accept a request for an exam. The only exception is for use in an emergency. In that case I can self-prescribe. Doctors in Australia can self-prescribe, but the ones I have talked to about it say they won't self-prescribe anything that would be questioned. So no opiates or things like that. Married to a doctor. When I'm sick, it's man flu. When she's sick, it's the apocalypse. I have to force her to stay home from work sometimes when she's sick. But I have patients, patients that don't need you coughing on them and making them sick. I don't really go to the doctor except for annual checkup labs. I do, however, self-prescribe things like eczema cream and asthma inhalers. A lot of this is driven by being a young resident, thus A, not really the demographic likely to have serious health issues, and B, not really having the time to go see a doctor due to my work schedule. Many of my peers have self-diagnosed themselves with appendicitis, small bowel obstructions, pneumonia, etc. and then presented to the ED though. I've also done the same for a lot of my friends over the phone. A doctor here. 3 of my co-residents had appendicitis last year, 2 while on shift. One did his own ultrasound and wrote his H&P for the surgery team. The other kept himself NPO after midnight during an overnight shift but kept seeing patients with MIF running. 0 post-op precautions were followed. Doc here. As a general rule, med students are hypochondriacs. Doctors are invincible. Ha, I remember at uni, every week the med students all thinking they had whatever weird condition they were studying that week. Same for microbial virology students though. The STD clinic gets way busier when they start studying STIs. My father is a radiologist. He had been having shortness of breath and chest tightness worsening over a few months. One day, after work was done and the clinic was closed, he hopped in the CT scanner and read his own CT scan. Massively enlarged lymph nodes all through his body. Lymphoma. He's alive and well after diagnosing himself with cancer years ago. Good to hear. My mother has lymphoma and chemo didn't work, so now we are just hopelessly waiting the end. Frick cancer. Pharmacist here, and it seems several people have questioned if it is legal for doctors to write prescriptions for themselves. It is legal, at least in Illinois. It may not be in other states, but there are potentially ethical issues if it is for a controlled substance or for a type of medication that is outside their normal scope of practice. RI allows self-prescribing, but most pharmacists I know choose to fill only non-controls for self-prescribing. I haven't met anyone who does differently. My ex is a doctor and this subject came up. He was terrified that he had some kind of low symptom cancer like lymphoma or an autoimmune issue, but he didn't want to actually get it seen about. The idea of treatment was worse to him. The knowledge of exactly what was needed to find out apparently was not comforting. Not only that, but sometimes seeing all the steps that are involved in treatment can frick you up bad. Like, if you're experiencing symptoms but not a whole lot, that sounds far better than dealing with the realities of chemo and or radiation that we see every day. I am a resident. I had a doctor's appointment and I let my attending know a week in advance. He chewed me out over email and CC'd my program director, saying that I obviously didn't take the rotation seriously. My PD was P. They had my back and told me to go to the appointment. The attending emailed me the next day with a forced apology. Butthole. Good on your PD. That reaction is my nightmare. Wife is a surgeon. Some magic happens as soon as she's on call. No longer sick. 100% fine. Then gets sick again after her shift. It has to do with some weird space-time vortex, I believe. Not in the specific spirit of the question, but when I'm talking to my patients about code status, full code is CPR ventilator if needed, versus DNR/DNI, and they ask me what I would do, I always tell them that doctors statistically opt for far fewer heroic end-of-life measures than non-medical folks. Like was said in other comments, little stuff is no big deal, but it seems like as a group we're less aggressive and seeking care. I survey my symptoms and list them, as if a PT were complaining about them to me. If I don't identify any immediately concerning red flags, I treat the symptoms myself. seeing a doc if I truly need ABX, steroids, etc., and reassess about 1 week later if not totally improved. I do have a lymph node, a few moles, and a weird bump I feel occasionally under my stomach under chronic scrutiny. When you work in medicine and go to the ER, you will have heck to pay if it's not for a legit reason. I would sooner suture myself if possible than go to an ER and let them see me bleed. Truth be told, sometimes I think about faking the right symptoms to my PCP to get a total body MRI. Lmao. Actual doctor here. Oncologist. It depends on the scenario. I can prescribe myself non-controlled drugs like antibiotics, steroid creams for eczema, etc. Simple things I can self-diagnose clinically. If I need lab tests or workup I need to see someone. I see a lot of variation. Some are ridiculous and have to be physically dragged to see another physician, where they sulk like a child because they're being asked all the normal questions that need to be asked when someone is ill. Some are very stoic. They know what needs to be done. They just sigh and get on with it. I think I've seen this more in physicians who get a significant diagnosis too. They know what the prognosis is and the treatment. I've only seen a small number freak out, generally refusing to get something checked because they're convinced it's something malignant. I don't think I've ever come across any hypochondriac clinicians. If my family is any example, they diagnose themselves and write prescriptions. Lol. Source: 2 doctors and 1 nurse practitioner. I'm very lucky that I've never had anything seriously wrong with me. However, when I do experience any symptoms, about 90% of the time I know what's going on and can determine if I need to seek out additional help. Plus I have colleagues I can bounce questions off of. Need a diagnostic test? Book an appointment. Need some medication? Book an appointment. Sometimes doctors will call in medications for each other. It's generally looked down upon, especially if they are controlled substances, but sending in antibiotics or something is relatively common. I was a professional ski patroller for almost 2 decades and I swear, doctors and nurses compete for the Black Knight Award. Monty Python reference. Me. Well doc, judging by the fact your foot is spun around almost 360 I'd say you have a spiral fracture tib fib. Doc, nonsense. Just a scratch. Once had a doctor refuse a backboard. I did everything but shoot him to get on the dang board and he refused all treatment. Then he got in his car and drove to his cabin. Around midnight his thigh muscles relaxed enough that it no longer acted as a splint and his leg folded. Fractured femur. Nice guy though. Sent me a bottle of Glenfiddich and told me next time to just club him and tie him down. I pretty much know what's going on with myself, but for anything that requires long-term meds, I like to have it documented, so I'll go in. I have to remind myself that I can't just bump up my dose or whatever because I have a provider to do that for me and it's disrespectful to cut her out of the loop. We'll put in lab orders or call in short-term prescriptions for each other. I called for a colleague once and the pharmacist shortly told me that he should have done it for himself as we're able to self-prescribe. In practice, though, we frown upon that. I've been practicing the last 14 years or so. I diagnosed my own DVT after an ankle fracture, and a year later diagnosed my own saddle pulmonary embolism. Granted, it wasn't a tough diagnosis. I was literally dying. Obviously both diagnoses required actual confirmation with imaging and I didn't manage them myself. As a doctor, I'm constantly convinced that nothing can ever go wrong with me and also I probably have leukemia. I respond by postponing. Now for several years. My family is full of doctors. My dad has gone to work with gastro and a bucket. Initially refused to go to the hospital when he thought he was having a heart attack. When he finally did go, he took his laptop and the nurses couldn't get him to stop working. Ignored all his own knowledge about letting a broken bone or torn muscle heal before doing physical work. Doctors do make the worst patients. My bill is a head and neck surgeon. Very smart guy. I have to wonder about common sense. He recently got a slightly detached retina. Because he had a surgery for one of his patients to do that day. He had his eye surgery in the early morning without anesthesia. He said it was horrific, but he did his patient's surgery that afternoon. They bumble around, sick, until an exasperated nurse finally corners them and forces them to take medicine, sit down, go home. I'm a nurse. Okay, so my dad is a doctor, and one time when I was around 7 he fell out of a tree directly onto a rock while we were camping, and he had a deep scratch on his side. He told us he was okay and nothing was wrong, so we left as planned and canoed back to our car without incident, besides my mom constantly telling him to stop paddling because of his side and him telling her everything was fine. He basically just said it was a scratch and nothing was wrong. About a week later, he was having trouble breathing and he still wouldn't go see a doctor because he self-diagnosed that he was okay, so my mom had to force him to go to the hospital and get an X-ray done, and it turns out he had 2 broken ribs. So not only do doctors self-diagnose themselves, they are also pretty dumb when they are doing it. TLDR. My dad's a doctor idiot and he wrongly self-diagnoses himself all the time because he thinks he's immortal or something. One of the reasons we are advised if another doctor comes to you for help, you'd better give him priority is that he'd tried to treat himself for a while and he wouldn't come to you if it wasn't really serious. You have been visited by the romantic doggo. Comment love is magic so you never fall in the friend zone. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.